Hello.
Hi, my name is Irfan. I'm the pharmacist on duty. How may I help you?
Actually, I'm here for a concern. I have a concern,
Okay.
and I'm very much worried regarding that.
All right. Please have a seat. This is our private counseling area.
Okay, thank you.
So whatever we discuss shall be kept private and confidential.
Okay, thank you.
All right. May I know what your concern is?
Actually, my son, Matthew Gray,
Okay.
he is on one of the medication for his depression,
Okay.
and he's using that medication since 6 months.
All right.
But a few days before, I read an article on the internet that this medication give a side effect of suicidal thoughts or something. So I'm very much worried because he just turned 19.
Okay.
So I don't want to suffer him from these side effects just only because of that medication.
All right. Okay. I appreciate your information and concern as well.
Mm.
And it must be a little hard for you as a mother. I understand that. Is it okay if I ask you, do you have a consent for your son?
Yes, I do.
Okay, I appreciate that. Thanks a lot. And I'm just going to repeat your concern in short. Your son, Matthew Gray, 19 years of age, and he is on vaccine, as you said, that he's stable on it.
Yes.
And your concern is that you read somewhere in the internet that this medication causes suicidal tendency,
Okay.
and you are concerned that if that is applicable on your son.
Oh, yes.
Okay, I appreciate that. Is it okay if I ask a few questions
Oh,
regarding
yes,
your
sure.
son's information?
Yes.
Is he allergic to any medication?
No.
Okay. Is he currently taking any other medication other than vaccine?
No, he's not.
Any over-the-counter herbal vitamin supplements?
No, doctor said not to take any.
Okay, I appreciate that. Thanks. Any other medical condition other than depression?
No.
All right. A few lifestyle questions. Do you mind if I ask?
No.
Okay. So does he take coffee?
Sometimes a cup of coffee.
All right. And how about his diet?
Diet, when he has started venlafaxine, so we notice improvement that his appetite has increased and he's doing well.
Oh, that is good. And how about his exercise? Does he have time?
Yes, he usually go to the gym
Mhm.
and he go for walks with his friends as well. So when he started venlafaxine, so there was improvement in physical activity as well.
Oh, that is good. So you are yourself acknowledging the fact that ever since he was stable on the medication, which was since 6 months,
Mhm.
there was a considerable improvement in his diet, which is appetite,
Mhm.
and he has a tendency to be physically involved as well.
Yes, we had an appointment with the doctor and he said like his condition is pretty much stable on this medication and he's doing well on this medication. So I was thinking like because of suicidal side effects, should I stop the medication or what should I do?
All right. As for the first part of your information that you gave, it sounds really good. So this is good that he should be, if he's stable on this medication, he should keep taking that. Coming down to the other point,
Mhm.
that you read somewhere in the internet and you're not even sure whether the source was authentic or not.
Oh yes, I'm not sure.
So this is the thing that it is not necessary that that thing would be applicable to your son. Well, yes, this medication has a tendency
Okay.
to cause suicidal ideation or suicidal thoughts
Okay.
in patients,
Mhm.
but there are certain other factors. So your son not necessarily means that he should be coming up within that bracket, because everything seems to be perfect. He's
Mhm.
improving on his diet. He's exercising, and how is he with like socializing? Does he form group of friends? How is he?
Yes, as I mentioned, he go with friends, so he's no more like isolated.
That is good.
So he is enjoying the company of people.
So this is one good point, because if in case of suicidal ideation as a side effect of this medication, one of the behaviors, which is the eccentric behavior that might come up with this, that people tend to become a little isolated. And
Okay.
it is when they become isolated that they have certain suicidal thoughts in their mind.
Okay.
So since you're saying that he's stable, it is not the case with your son, and you don't feel any side effects, you don't feel any violent behavior or aggression.
No, not yet. But should I keep an eye?
Well, it is good to keep him monitored since this is your concern,
Okay.
and keeping him under your surveillance or monitoring won't be a bad idea.
Okay.
As a family member, as someone who is part of the family. But just in case, if you feel any certain behavior, any of certain things like self-harming or harming others, or any violence or aggression,
Okay.
or any unusual behavioral changes recently,
Okay.
because if that happens, you need to speak to the doctor. But you don't have to discontinue the medication.
Okay.
The medication has to be taken. Your doctor is the person who has to decide whether it has to be discontinued, it has to be increased by the dose, or it has to be decreased by the dose.
Okay.
Because whatever dose your doctor has prescribed your son for is in the best interest of his current state.
Okay.
Since he's stable, so keep taking as your doctor prescribed, and speak to your doctor, go to your doctor in case you feel any of the ones that I just mentioned.
Mm-hmm.
Besides, keep him socialized, make sure that he keeps doing that. Healthy diet, healthy exercise, incorporating physical activity would always be a plus when it comes to improving his depression symptoms and the indication that he's using this medication.
Okay, fine. No problem.
All
Thanks.
right. Is there any other concern that you want me to address?
No, not right now.
Is it okay if I ask? If I call you in a couple of weeks to see how?
Oh yeah, sure. You can give us a call. No problem.
I really appreciate you, Helen. I'm sure the information that I gave has been
Yeah,
instrumental to you.
it's so good, and I feel so relieved. Thank you so much.
It's always a pleasure. Thank you.
Thank you.
Bye.